Are you aware that your skin can serve as a crucial indicator of your overall health? Diabetes, a widespread condition affecting millions, often presents itself through subtle skin signs, ranging from dark patches to blisters. In this video, we will delve into the skin's role as an early warning system for identifying this chronic illness, as well as what actions you can take. It's time to tune in to your body's largest organ. It might be trying to communicate something to you. First on the list, let's discuss the skin signs of diabetic dermopathy, also known as diabetic shin spots. These spots manifest as small, slightly reddish or brownish scaly patches, primarily appearing on the legs. They occur in approximately half of individuals with diabetes, usually around 18 to 24 months after the condition's onset. These patches gradually vanish, leaving behind skin depressions and increased pigmentation. It's important to note that these conditions are more prevalent among men and seniors and are often linked to other diabetes-related health issues, such as nerve damage, kidney disease, and heart disease. One theory proposes that diabetic dermopathy results from damage to tiny blood vessels in the skin, causing pigment accumulation due to hemosin, a byproduct of hemoglobin breakdown that influences melanin, the skin's pigment. Another theory suggests that diabetic dermopathy may be linked to nerve damage, leading to decreased skin sensitivity, causing minor skin injuries to go unnoticed. While this benign condition typically resolves on its own, it underscores the necessity of diabetes management since it might signal more severe underlying health problems. Unfortunately, there isn't a specific treatment for diabetic dermopathy, and available treatments like topical corticosteroids or laser therapy often yield limited results. Next, let's explore bullosis diabeticorum, a rare condition that affects approximately 1% of the U.S. population. This disorder is characterized by the sudden appearance of firm, painless blisters on the skin, usually on the hands and feet. These blisters come in various sizes and tend to appear on both sides of the body simultaneously. While this condition is more common in men and those with type 1 diabetes, it can develop in individuals above the age of 50 or those with long-standing diabetes. The exact causes of bullosis diabeticorum aren't clear, but factors such as exposure to UV light, fluctuations in blood sugar levels, nerve damage, or other variables may be involved. If you experience this condition, it's essential to protect the affected skin and monitor for signs of infection, as complications can arise from infected blisters. Have you heard of acanthosis nigricans? Unlike other skin conditions, this one is relatively common. It's characterized by dark, thickened patches on the skin, often with a velvety or warty texture. These patches typically develop in areas like the neck, underarms, elbows, and groin. Acanthosis nigricans can occur in individuals with insulin resistance-related conditions such as obesity, polycystic ovarian syndrome, and thyroid dysfunction. The presence of high insulin levels in the body can activate receptors on skin cells, leading to increased cell growth and skin thickening. If you notice these skin changes, medications like metformin, which improve insulin sensitivity and blood sugar control, can be helpful. Moving on, let's discuss eruptive xanthomas, a condition associated with elevated triglyceride levels in the blood, particularly in people with diabetes. This condition manifests as clusters of small, pink or yellowish pimples that suddenly appear on the skin. These bumps are commonly found on the buttocks, hands, legs, and other areas susceptible to injury. Eruptive xanthomas can be tender or itchy but are typically painless. They result from changes in how the body processes fats when diabetes impairs this process. Treatment usually involves addressing the underlying factors contributing to elevated triglycerides, potentially through medications like fibrates or omega-3 fatty acids. Now, let's discuss diabetic foot syndrome, which affects the feet due to factors such as nerve damage, poor blood flow, and impaired wound healing. Around 1% to 4% of individuals with diabetes experience this condition, with a slightly higher prevalence among those with type 1 diabetes. Diabetic foot syndrome typically begins with dry, itchy skin and the development of calluses due to diabetic neuropathy. As the condition progresses, it can lead to chronic ulcers, which are more likely to occur in areas of the foot prone to trauma, nerve damage, or poor blood flow. The presence of secondary infections can complicate the healing process. It's vital to seek prompt treatment if you notice any changes in your feet. Moreover, diabetic foot syndrome can lead to diabetic neuroosteoarthropathy, often referred to as shadowy foot. This debilitating condition can cause the midfoot to collapse, leading to toe deformities. It's essential to be vigilant about any signs of redness, warmth, or a burning sensation in the feet, known as erythralgia. To prevent and manage diabetic foot syndrome, focus on controlling your diabetes, maintaining proper foot care, and wearing comfortable, well-fitting shoes. Regular checkups with a healthcare provider are essential. Next on our list is generalized granuloma annulare, GGA, a rash affecting 10% to 15% of individuals with diabetes. It begins as small, skin-colored or reddish bumps that gradually form ring-shaped patterns on the skin, varying in color. These rings can range from 0.5 centimeters to 5 centimeters in size and typically appear on the buttocks, arms, and legs. GGA is usually not painful but can be itchy, and it tends to persist over a long period. Unfortunately, there is no one-size-fits-all treatment for GGA. Medical practitioners have attempted various approaches, such as antimalarials, retinoids, and steroids, but the best treatment plan will vary from person to person. If you observe ring-shaped rashes on your skin, you may need a treatment plan aimed at regulating your blood sugar levels. Now, let's touch on skin tags, those small skin flaps that can emerge on your neck, underarms, or around your eyes. Skin tags, also known as acrochordins, are benign skin growths often found in areas where skin rubs against skin. Up to 75% of individuals with diabetes may develop skin tags. They are more common in people who are overweight, older, or women. While skin tags are relatively harmless, they can be bothersome or affect self-confidence. Some studies suggest that the number of skin tags may indicate a person's risk of developing diabetes or insulin resistance. Although skin tags are not harmful, they can be removed for cosmetic reasons through excision or cryotherapy. Finally, diabetes can also lead to scleroderma-like skin changes. Studies estimate that 10% to 50% of diabetes patients experience this condition, which is more common in those with type 1 diabetes and those with long-standing diseases. Scleroderma-like skin changes involve painless, hard, and thickened skin, typically occurring symmetrically around and between the fingers. In severe cases, these changes can extend to other parts of the hands and arms. The thickening of the skin results from increased collagen, triggered by reactions related to advanced glycosylation end products or the accumulation of sugar alcohols in the skin's top layer. These changes are associated with an increased risk of nephropathy and retinopathy in individuals with type 1 diabetes. While tight blood sugar control can help, there are limited treatment options for scleroderma-like skin changes. Physical therapy can be beneficial in maintaining and enhancing joint mobility for those with restricted ranges of motion. To prevent these skin changes from worsening, it's crucial to manage diabetes and its complications through lifestyle changes like maintaining a healthy diet, regular exercise, and a healthy weight. If you've experienced any of the skin conditions mentioned above, please share your thoughts in the comments below. Your experience may help others facing similar challenges. Thank you for watching the video. We invite you to subscribe and leave a like or comment. Your support is very important for us to produce and share other valuable content.